One of the things I tell people about Western medical diagnosis, especially when it comes to cancer, it is good to have a diagnosis, to have a place in the ballpark. What ballpark are you in? You have a neurological problem, you have cancer, diabetes, metabolic syndrome. Doctors, through their tests, can give us a superficial picture, but a picture. When I talk to cancer patients and they ask about tests, I always say, stop the tests, enough with the tests. It's cheaper just to assume the worst. If you have cancer, or you're doubting whether you have cancer, and it's not totally clear, it's best, or it's cheapest, in terms of diagnosis, to assume the worst and treat for it. Then you're on safe ground. What's the point of continuing to do tests for cancer patients that are dangerous? CAT scans, biopsies. Many of the things that doctors do actually increase one's chance of getting cancer. So to know, okay, where your cancer is this week or this month, to take a CAT scan and expose oneself to pretty high levels of radiation, and to do this frequently, is not going to help. It's going to hurt. So it's cheaper to assume the worst and treat for it. You don't need to be reminded. But most of us, without a diagnosis, don't get scared enough to pay attention. And paying attention is what it's all about. Paying attention to oneself. All the tests that we talked about in this course, these are simple tests that one can do at home. If you got all of the equipment I mentioned, probably could do for $1,500, $500 going to the VetaPulse machine. It's like going into a car station. You might have a diagnostic title, or the car might be running rough. The mechanic has to open the hood. If you have cancer, you have to open the hood and use all of the different things we've talked about. You need to see how acidic you are. You have to see what your oxygen levels are. You have to see and measure your breathing rate. This will tell you about your cancer or other diseases. The title, the diagnostic title, is just for doctors so they know what drug to treat you with, what pharmaceutical. In the medical approach, natural allopathic medicine, we're looking under the hood to the dynamics going on inside of us. And with that, I hope and wish for all the health and happiness that you can gather through using these basic principles for oneself and for one's loved ones. Of course, mothers armed with these diagnostic tests are going to be better able to take care of their family. So I wish you all the luck.